In this video, we are going to talk about non-invasive ventilator part 3. In part 2, we see about the invasive ventilator and its volume mode. In that, we talk about CMV, AC control, the SIMV and IMV. Okay, the pressure mode is still remaining. Now we talk about the non-invasive ventilator and its mode. CPAP and BiPAP. CPAP, that is continuous positive airway pressure, and BiPAP, that is bi-level positive airway pressure. It's the first type in that continuously or the constant pressure is provided to a patient during a spontaneous breathing. So it allows to observe the ability of the patient breathing spontaneously while still on the ventilator. If patient still on the ventilator, the CPAP mode is observe the patient's ability, how much patient can do a ventilation, and then it's support to a patient. CPAP can be used for generally in non-intubated patient, okay, because it is a non-invasive type of ventilator. So CPAP is a non-invasive ventilator mode and it may be used as a winning mode. Which conditions CPAP is useful? So it decreases the FRC and lung compliance and the refractory hypoxemia. Okay, in that condition, the CPAP mode is useful for increase the FRC and decrease the lung compliance. In that type of condition, it is very useful. Advantage: it prevent atelectasis or collapse of alveoli. Atelectasis, that means collapse of lung, so and collapse of alveoli. So the CPAP mode is prevent that condition. It treat the hypoxemia. Hypoxemia, that means it decrease the oxygen delivery to a tissue. Okay, so that means it treat a hypoxemia via the continuous applying the pressure to a ventilated patient. It treat pulmonary edema. How? So it help to the pressure help in expulsion of fluid from alveoli. Okay, if the collection of fluid in the lungs, so the pressure which is generated by the CPAP mode, it help into the expulsion of fluid from the alveoli. Improve gas exchange and deoxygenation. Mostly CPAP is used in pediatric and patient who want weaning from intermittent mandatory ventilation. See in the diagram, the shows it is a pressure versus time graph, and here the pressure flow is constant, okay, and the spontaneous breathing done by the patient. So spontaneous breathing on one pressure level is shown into the graph. Next we talk about the BiPAP. Okay, it is a second pressure mode of non-invasive type of ventilator. BiPAP, that is bi-level positive airway pressure. It is non-invasive ventilator mode and ventilation is provided by the nasal mask or we can use a full face mask. Okay, so that's why it is known as non-invasive type. BiPAP. So generally remember BiPAP means IPAP plus EPAP. So IPAP means inspiratory pressure support level and EPAP means expiratory pressure support. Okay, so in this type of ventilator, the system allows the clinician to select two levels of positive pressure support. That one is IPAP and second is EPAP. Indications: so acute and chronic hypercapnic respiration failure, ARDS, that is acute respiratory distress syndrome, weaning from invasive ventilation, and in heart failure patient and in pneumonic patient it is useful. Generally it is useful because in BiPAP it provide a IPAP and EPAP, that means in inspiration is also provide a pressure support and at expiration is also provide a pressure support. So that wise is useful in this type of patient condition. Contraindication: vomiting because you apply a face or nasal mask to the patient for ventilation. So if patient can do vomiting, okay, so facial burns, upper GIT surgery and hemodynamically unstable patient. Face trauma and facial burns is also contraindicated for the BiPAP mode because you apply a face or nasal mask, so trauma is already onto the patient face or burns is already present on the face of the patient, so it hamper the condition more. upper GIT surgery and hemodynamically unstable patient. In that condition, we not use a BiPAP mode. Here the graph shown a IPAP and EPAP. Okay, the pressure is on the inspiration also and pressure support at the expiration also. So the spontaneous breathing is shown into the graph. Thank you.